I want to thank all my colleagues for really sticking with this process from the very beginning, something that we launched in January of this year. But actually, the previous council had taken action on a resolution that I introduced along with then Council Member Mark Elrich, and it was unanimously, was co-sponsored by all my colleagues and unanimously adopted. English is my second language, I have to remember that. That called for the establishment of a racial equity and social justice policy. And so what we did was affirm our commitment to do that, and now we are here after an entire year to pass legislation. So I really do want to thank my colleagues for all of their the time that they have invested in getting us to this particular point. I also need to thank personally my staff, Roland Ikeloa, Berta Cersosimo, Craig Wilson, Ben Price, and Mayra Cruz Solis, for putting up with me during this whole entire time, but really being central in getting us to this point. It's been really amazing to work with Team Navarro. Dr. Elaine Bonner-Tompkins, for all her hard work. She is someone that I immediately knew had to be a lead for this particular effort, because she has been working on these issues for such a long time through her capacity on the Office of Legislative Oversight, really looking into a lot of super important areas and disparities and giving us that data and really informing us and supporting us through a lot of the work when it comes to issues of disparities and it comes to issues of gaps and things of that nature. So she was instrumental in getting us to this point as well. Tiffany Ward, who actually was here as an analyst for then Councilmember Elrich, but now as the equity program manager, also was instrumental in this work. This has been an amazing teamwork. Of course, our attorney, Bob Drummer, who took all of this input, this feedback, all of that information, and really put it into the format of legislation, and I really have enjoyed working with him, not just on the original bill, but also as we work through the amendments and that were adopted through the GO session. So I really appreciate that. We also established partnerships with Leadership Montgomery. So C. Marie Taylor was really wonderful to work with, as well as the Racial Equity Institute, and putting forth these workshops that we attended. Actually, was the leadership of the county. We started in January. We finished just a couple of weeks ago, and really delved deep into a lot of the issues, the historical context, a lot of just rooted history that has not only established and put forth the social construct of race and racism as an economic tool, but also then looking at our community here in Montgomery County, a community that is so diverse, which you cannot, even with all of these workshops, begin to understand all of the nuances, the history, the consequences, the persistent institutionalized structural issues that affect all of us because we're not homogeneous. And so it was, I think, though, really important, and I appreciated participating in those workshops because not only did it, I think, highlight that history, but it also, I think, reinforced for many of us this notion of how connected we are. How connected we are, not only here in the county, but from all the different places that we come from where all our ancestors came from. And so it was a very, I think, important frame. I really, really appreciated that. I do also want to, of course, acknowledge that, we held 3 really large community conversations where over 1,000 people participated, and it was a real snapshot of our community, and that was really exciting because we developed a toolkit. Many other conversations took place in different neighborhoods and organizations, and that was really awesome. The MORE Network, which is a coalition of a lot of organizations that we have worked with for many, many years, also came together and really were very deliberate in looking at the original bill and offering some amendments that we really, truly appreciated. I also want to thank the Latino Health Initiative as well as the African American Health Program for highlighting some other issues and bringing forth and validating some pieces that we needed to address as well. So I want to say that this has been, really awesome, and I particularly love the participation of our young people. So there was a youth town hall that the former member of the Board of Education, student member, hosted, but you know what? Also during our own youth town halls, this issue has been brought up, and our young people are very energized, and of course right now there's a lot of conversation as the school system undertakes boundary change studies. So we know that this is now an issue and a topic that is central in many of the things that we discuss. So let me say that on November 14th, the GO committee held a work session to go over the bill and make amendments. The work session was really a follow-up to what I just mentioned, not only the community conversations, but 2 public hearings where we had over 43 speakers. As I said before, I'm still really in awe of how everybody continues to stay engaged and still working on so many of these particular issues. I do want to emphasize that as I was thinking about this day on my way here, the word instrument kept coming up for me because this is what this is. This legislation is an instrument. It is what can allow your local government to, in a disciplined fashion, have before us data that will help us make decisions that can then begin to the very patient structural work of dismantling many of those structural barriers that have led to these disparities. This is not the answer to everything that we are facing in this county. And I have heard a lot of feedback, and one particular one was interesting. Somebody said to me, it was a reporter that said, well, there's this particular professor that says that Montgomery County is so progressive, you really don't need legislation because we're so great. And I said, yeah, we are, but obviously if we were so great, then, and if these things were so easy to solve, we wouldn't still have the disparities that we have. So this is an instrument to begin that process. So in that sense, I know for a lot of people, it's still kind of odd, to wrap your head around what this is. But I think that this is a way for us as government to do our part. Government cannot do everything. Obviously, we have to work together. We all have to pitch in, whether it's just, community members, nonprofit organizations, the private sector, et cetera. But this is an instrument that we can use to equip us to better address these issues, both legislatively and through budgetary decisions and through initiatives, et cetera. So I wanted to make that point. I also want to say that just as a point of personal privilege, there was a professor when I was a sophomore at the University of Missouri-Columbia, Lois Bryant, and one of the very few African-American professors at that time, who opened my eyes to a lot of this work. And, in her memory, I just want to say that I dedicate this work, this day, to her, because there are some people that come into your life and really change you forever. And I have to say that she was one of those people who took the time to do that, and I so much appreciate that. I want to also bring up a few items before I go into the specifics of what we did. We did receive some communication. This is an exciting time, actually. Thank you. That's a good segue. That's a good segue into what we're going to say.
Wow.
I do want to address some specific issues. So we did receive some feedback around concerns that health was not mentioned in the bill. But I wanted to make sure that everybody knows that it is mentioned in the bill as very prominently on lines 26 to 29 of the bill. It is specifically mentioned as one of those disparities that we need to address. And so basically, if you look at line 28, it says, these disparate outcomes among county residents include wealth, housing, criminal justice, education, and health. So it is there. Also, I just want to remind us that there is an HHS member that is suggested as part of the advisory committee. So for both, especially our health initiatives and programs who have worked so hard, I just want to make sure that everybody knew that, of course, this is front and center, because this is one of those disparities that we've been working on for so long, and therefore just wanted to make sure everybody knew that. We also received some feedback in terms of having the Office of Human Rights as part of the advisory committee. And the one thing I would mention is that we did have a conversation, as we were looking at the bill. There are two issues that I like to just point out. One is that our Office of Human Rights, of course, we rely on that office to enforce a lot of different particular issues that we have adopted through legislation. We've made them the enforcement, department. So there's that piece in terms of having a little bit of that firewall. But I will also say that the bill is not static in terms of who should be the members of this committee. It is static in terms of how many public members should be, but it's at the discretion of the executive through regulation whether he would like to make a change, in a year and rotate the different departments, et cetera. So that can be up to the discretion, but I just wanted to also mention that one of the main reasons was because this is an office that also deals with a lot of enforcement issues related to many of these topics. So I wanted to address that. And also in terms of the composition of the advisory committee, it does also state that on lines 205 to 212, that it must reflect a range of ethnicities, professional backgrounds, socioeconomic status, and places of origin to reflect the racial, economic, and linguistic diversity of the county's communities, with an emphasis on those most disproportionately impacted by inequities. And so, and each member should have some experience in redressing disparate impacts based on race and social justice issues. There was further suggestion that came to us after the GO committee session, asking that we put in a requirement that all the advisory committee members be residents of the county. What I am offering is that the public members should be residents of the county, because it could be that, that we might have a director of a department or somebody who's an expert but may not be a resident of the county, and we want to take that, take advantage of that expertise. But I think that having public members of the committee as county residents is something that I think would be very worthwhile doing. So that I've asked Mr. Drummer to draft language to that effect. And lastly, I will also say that as we go through the packet, something that also came after the GO committee session, we're also some slight amendments to concerns raised by the LGBTQ community, and Councilmember Glass has some language to address that. So with that, I will just kind of go over what we did at the GO committee, and then of course we'll get into a conversation and Mr. Drummer can clarify anything else. So the bill as amended is going to establish a racial equity and social justice program. It's going to establish an Office of Racial Equity and Social Justice in the executive branch with a non-merit head. It removes the Chief Equity Officer position in the Office of the Executive as a non-merit position. That is because there's already a position that has been budgeted, so we didn't want to have duplication. It requires the executive to adopt by Method 2 regulation a racial equity and social justice action plan for the county. And that just means that the council also has an opportunity to take a look at that regulation and have an opportunity to opine whether this is something that we believe we should go further, or whether there should be some amendments. Require racial equity and social justice training of some type for all county employees, and that was one of the amendments. It was important that it would be all employees. Before it was just managers. We don't prescribe, of course, in legislation how that training should be offered, because that would be something that the executive would decide through regulation. But there are very many different ways that this can take place, and so we felt that it should be for all county employees. Require each department and office to develop a racial equity and social justice action plan. Require the Office of Legislative Oversight to submit a racial equity and social justice impact statement to the council for each bill, and invalidate a non-expedited bill enacted without an impact statement. So This was one of the amendments that I put forth in the committee because this way it is our Office of Legislative Oversight who is responsible for the impact notes for legislation. For budgetary or initiatives, that would be the responsibility of the executive branch. And in this way, we did note that it would invalidate a non-expedited bill enacted without an impact statement. The fact that it is the Office of Legislative Oversight gives us a little bit more control to make sure that that statement is actually received, because you don't want the unintended consequence of not having a statement and then a bill being invalidated, and all kinds of interesting things could happen. Require the executive to explain how each management initiative or program in the recommended budget would promote racial equity and social justice, and that speaks to the fact that his his side of the aisle would address issues when it comes to budgetary and any initiative, et cetera. Establish a Racial Equity and Social Justice Committee with 8 public members, and this was something that was recommended by the Moore Network, that we should increase the number of public members. 7 members representing county departments or agencies, and establish the duties of the committee. Authorize a $2,000 annual stipend for the 8 public members of the committee. And this was another recommendations from the Moore Network, recognizing that we want to be able to hear from a cross-section of our county residents. There may be residents where it might be prohibitive to participate if they don't have some kind of stipend of sorts to pay, maybe for transportation or for childcare or for whatever it is. So this was something I think that as we talk about recognizing who we are as a county, we need to adapt also and facilitate those kinds of participation. It is oftentimes, we have heard time and time again how only certain people can take the time to participate because, they have access to transportation, or they may have the means to do certain things. So this was, I think, a good recommendation and a good compromise. Instead of, having compensation like we do in some other quasi-judicial committees or advisory boards, this is a stipend, not necessarily, like a salary. Require the planning board to consider racial equity and social justice impact when preparing a master plan. Require the council to ensure sufficient funding for the program. And that particular one was also, emphasized by many of the community members, that we needed to make sure that the funding was there. I suggested, just like we did with the economic impact statement bill, with the Inspector General bill, where we strengthened the Office of the Inspector General, that we included there, so it's clear that this is the intent of the council. But we know that the charter states that everything is subject to appropriation. So even though it is included, and even though it is to signal, it is important that we know that that's what the charter calls for. So this is not a guarantee, but it's definitely something, of course, that we want to commit to. And then delay the effective date of the provision requiring an impact statement for each bill until August 1st, 2020. So the bill has an effective date, it's 90 days, but we are delaying the requirement for the impact statement for each bill because we have to understand that we're gonna, we need to put the funding in place. Then people that are gonna have to be hired need to be put in place. And so we didn't wanna set it up where we're getting overly excited and ambitious, and then it turns out that when you look at the logistics of the implementation to have staff in place, we would be violating the bill. So we decided, let's do this because we do know that we're gonna engage in an operating budget process, and that we're gonna have to have folks who are gonna have to be identified, are gonna have to be hired. So that was a compromise in terms of this particular issue.